Okay, thank you once again, all of you, waiting for this video every week and joining in all my live videos since the last 1 year, okay? Alright, so today is the last topic for this menopause series. So we have altogether 4 live videos, and for those of you who have missed the earlier live videos, please go to my YouTube channel, which is in the link in this post. Go to the link, go to my YouTube channel. Remember to subscribe my YouTube channel, especially for some of you who are regular watching YouTubes, because you may not be so regular on your Facebook, or you may miss the live video. So it's better you subscribe to my YouTube channel and switch on the notification button, so you will be notified every time I have a new video posted up there, okay? We have so many videos up there since the last beginning of MCO, all the way from April until now. There are many videos up there for you to watch, and if you miss any topics, you can always go back. So if you're interested on menopause, you can go back. There is already three previous videos on menopause in the YouTube. And also, if you are interested on painful sex, I even talked about painful sex already during one of my videos previously, but that one was not specific to menopause, but you will find certain similarities and certain things that you can relate, whether menopause or not menopause, okay? So painful sex is painful sex, so they are more or less the same. Maybe for non-menopause they are a bit more, but for menopause there is still certain overlapping things that we have for both cases. So if you have missed all this, you want to know more, you can always go there and go to my YouTube channel and look for those videos, okay? And for next week onwards, I will also be having a series of videos that are very interesting, which is all on my favorite topic actually, that is endometriosis. Endometriosis has been my passion for the past few years, especially partly after I stopped cut down on my obstetrics. I started putting more focus on endometriosis. One of the reasons why I focus more on endometriosis, because I realized there are a lot of women out there who are suffering because of endometriosis, and very often they are very lost. They do not know what to do, and many of them are very pitiful because they have multiple surgeries because of endometriosis. And I hope to be able to prevent that, because this was something that I have been taking many years to find ways to improve myself, so that if possible, whoever who walks into my clinic for the treatment of endometriosis, even if I operate on her, that will be one and only operation she needs for the rest of her life. So that is my aim. So I really pity those women with multiple operations. So you want to know more on this endometriosis series, please stay tuned, yeah, from next week onwards. I'm not really sure how many weeks I will take to finish, because I actually posted a post at Endometriosis Malaysia a couple of weeks back asking for questions, and so my topic will be endometriosis series, commonly asked questions. So there are so many questions that they posted out, and I'm going to try my very best to answer each and every question posted up there, so that I can help many more women with endometriosis. So one of the reasons why they are suffering is also because of lack of knowledge, and I hope with my live videos they will acquire more knowledge, and this will help them to get better and also avoid future recurrence of disease and future surgeries. And that is, I think, the utmost important thing. Okay, so today is on menopause and sex. This is one thing that is very common. A lot of women come to our clinic and ask this question, and some of them they may not ask exactly, sex, women and sex. Women are very shy over sex. You don't have to be shy, okay? This is already 21st century. And when they come and see me, many of them also will say, actually, they very shy to tell their previous gynae who is a man. So they come and they will always look for a female gynae to tell this problem. So that is why they have a tendency of telling me when they come and see a lady gynae when it comes to painful sex. And this is actually very common. Very common. Women have painful sex after menopause. This is something that is very common. And as a result, a lot of women actually stop having sex after menopause or slow down or slow down or have it so infrequent, maybe only once a month. So they actually slow down their sexual intercourse after menopause. Sometimes it's because they are in pain. One of the reasons could be also because they are in pain, but there is also another possible reason. Because as men grow older, some men also may not be able to perform sex so well anymore, because we know when you have like diabetes, hypertension, some men, they may not be able to perform as before, and their sex drive also come down. So as a couple, both of you grow older, both also sex drive come down, so that is why you start to slow down on having sex. Slowing down is fine as long as both of you are mutually agreeable, but sometimes it may not be. It may be only the wife no more mood to have sex, and because of pain start to push away the husband, but husband may not be the same. The husband may still want to have sex, so then there is an unequal need. So that is when if it is not solved, it can end up with some other problems. Okay, so then so what happened is why women have painful sex after menopause. I think that everyone also know. It's because when we have no more hormone, we dry up. We dry up everywhere. Yeah? We dry up on our skin. Many of us, when we reach a certain age, our skin also get drier and drier. Even our eyes, we can feel it sometimes. It gets drier and drier as you grow older. You have to put eye drops every day because your eyes is dry. And so is your vagina. So your vagina also get drier and drier as you grow older. And it's very significant after menopause. Another period of our life that we feel the same thing actually is after childbirth. After childbirth, many women also, especially if you're breastfeeding, you have a phase of like menopausal phase after when you're breastfeeding, where you have no menses. Some of us, after give birth, we have a few months without menses, and during that time we also have vaginal dryness, but may not be as significant as women who totally menopause. Totally menopause is a lot more significant, is a lot more drier. So because of the vaginal dryness, that is why women have pain during intercourse. And what happens is that in order to maintain this vaginal lubrication, one of the factors to maintain vaginal lubrication is to have sex more frequent. Let's say if you have sex very frequent all your life, I do not know how frequent is frequent, but let's put a number, okay? Let's say you have sex 3 times a week. All your life, you have sex 3 times a week. And after menopause, you still have sex 3 times a week. So if you still have sex 3 times a week, you don't actually have so much of vaginal dryness one. So we know that women who are still very much sexually active, they don't actually have much vaginal dryness problem, and as a result, they also don't have much painful sex problem. See? So if you keep having sex, then there's no pain. But what happened is that, you see, as you grow older, as I told you, the need comes down, even in some men. So if let's say your husband also never have such a strong drive like before, and now you maybe not yet menopause, but you already slow down your intercourse to maybe only twice a month or once a month, or maybe in your 40s, because both of you are busy working or high positions, very stressful job, stressful lifestyle, a successful business, busy business with multiple branches. So you also become busy, and as a result, you also have sex less, maybe also like once a month, maybe. So when you do that and you happen to menopause, and that is when your vaginal dryness become more significant. It become more significant because you're not having sex enough. So when you're not having sex enough, it become more significant, and as a result, whenever you have sex, it's so painful. It's so painful that eventually you will tell your husband, don't want, it's so painful. Darling, don't want because it's so painful. So that is how it all ended. So a lot of old couples actually, they stop having sex because of this, because of the pain. And the pain is because of the the dryness. And the dryness is because you're not having sex enough. So you're going into a vicious cycle. You have less sex, you have more pain. You have more pain, you have less sex. You have less sex, you have more pain. So it goes on and become worse and worse over time. So the other way is to have more sex, then less pain. More sex, less pain. The more you have sex, the less pain. And the less the pain, the more likely you're going to have sex. So that is how it goes. But it's easier said than done. Okay, so some couples are already in that situation where sex is a rare thing. It's a rare thing. Or maybe you can't help it. Your husband is probably diabetic, hypertensive, heart disease, and on multiple drugs. And as a result, the sex drive come down, and maybe your husband also difficult to perform, and as a result he also start to have sex less. His needs come down. So it's not that you want to have sex, you can have sex, you see. So it's a two-way thing. So maybe your husband also don't want to have sex already, or doing it less, and then you are in pain. So how are you going to solve that problem? So as a woman, you have things that you can do for yourself. If you reach a certain stage where you think that sex is painful, and you can't force your husband to have sex every day because maybe he is some big time director, manager, is always busy working elsewhere, or maybe he has already have multiple medical problem, and then taking a lot of medication, and as a result his desire to have sex has already come down. You can't force him, but he still wants it like, once a month, or on and off, like birthday, public holiday, New Year, Valentine's Day, anniversary, things like that. And it's so painful when you have it. Then what can we do? What can we do as women? There are a few things we can do. We can do things that involve medication. We can also do things that don't involve medication. Involve medication also, there are many types. There are tablets that we can take, and there are things that we can insert vaginally or apply vaginally. Okay, so medication normally we divide either something that we eat every day, or something that we apply or insert vaginally every day. And we also can divide it whether it's hormone or non-hormone. So you have hormone and non-hormone. So whenever we talk about hormone, everybody is like so scared. Hormone, I don't want. But you want to know more about hormone, you can look up, you can go to my YouTube channel and watch my video prior to this. The two videos before this, I did talk about hormone replacement. So if all the myths and the truths are all there, so you just go there and listen to it, and you will be able to decide for yourself whether you want to take hormone or not. So now a question, to take hormone or not to take hormone? So it's up to you. Go to my video and then you decide for yourself. So number one, you can take hormone. You can take hormone tablet. Hormone tablet which you have to take every day. Unfortunately, you can't take like only have sex, only take. Cannot, it doesn't work immediately. It takes time to work. And then you don't even know when your husband want to have sex, right? If your husband can tell you earlier, maybe your husband say, next Monday I want to have sex. Then you start taking hormone today until next Monday. You take 1 week, I think it will work already lah. But cannot, right? Sex is very often something very spontaneous, and then suddenly he wants, and then he will do it. So the question is, how are you going to predict? You can't predict. So most of the time, women end up taking pills every day lor. Of course, in certain situations where if you think your husband is always in demand of sex and you find it painful, and you have been rejecting him, but it's always high in demand, so one of the options you can think of is to take a hormone tablet. But other than hormone tablet, we also got hormone cream. Hormone cream is hormone that we only apply at our vagina one. But again, it doesn't work immediately, so you have to do it regularly. But at least hormone cream is something you don't need to apply every day. You can apply like only once a week, twice a week. It's already enough. And you don't have to worry so much about the side effects of hormone, because now your hormone is only at your vagina. So you don't have to worry so much. So you can apply like once a week, twice a week. But you cannot apply every day and forever. This is also not recommended because it's again hormone. You see, hormone tablets you can take every day, not too bad. But vaginal hormone, we don't recommend every day. So you can use it once a week or twice a week, that's all. Okay, so you have two types. Then if you're talking about non-hormone, are there things that you can take that's non-hormone? Oh yes, there are things that can non-hormone. There is a tablet out there that we can insert it, which is basically probiotic tablets. Probiotic tablet that you insert vaginally also help. So if you can find probiotic vaginal tablet, you can also insert in. Because what happens in menopause is not just your hormone goes off. When your hormone goes off, even your probiotics in your vagina also dies off. So that is why you have this dryness and this pain. So all you need is to insert probiotic into your vagina lor. Not tablet. A tablet probiotic don't go to your vagina, it won't work one. So you need to insert probiotic into your vagina. That is one way lor. So that is one non-hormone method. And next non-hormone method is to use moisturizer for your vagina. As I always tell a lot of women, when you grow older, your skin dry, you everyday put moisturizer. You know, your hand skin dry, so everyday you put moisturizer. And then your eye dry, you put eye moisturizer. Why you forgot about your vagina? So if you want to put moisturizer for your vagina, there are moisturizers that you can use for your vagina. But again, you need to use it every day. And not only when you want to have sex, it won't work one. You have to apply it every day. So basically, it's very simple. I always ask women to just buy KY. KY jelly is the easiest to buy from any pharmacy and is commonly used for the vagina anyway. But a lot of women, they get wrong info. When they have pain during sex, people say use KY. So they will buy KY and they use it only on the day they have sex. Oh no, it won't work. They will still tell you it's painful one. It won't work. You want to moisture your vagina, please do it every day. So what you need to do is you need to put it in your finger and put it into your vagina and rub inside your vagina. So it is again something some people can do, but some people will find it, put finger in the vagina, I cannot do. So it's still a very individual thing. But if you can do it, then of course it works. But most important, remember, use KY every day. Don't only wait until your husband want to have sex only you do it. It won't work. It will still be painful one. So moisturizer for your vagina is one of the method, and I wouldn't even call it medication because it's actually a moisturizer. So it's one of the ways that you can do to make sure you don't have vaginal dryness. So the question is, when do you start? You see, there are different phases of your life. Maybe you're just menopausing. If you're just menopausing, it's very easy. You can always take a hormone replacement therapy for a while. Maybe for a month only, you don't need to take long. Then there's no risk, there's no complication. You just take for 1 month. And then when you find that your vagina is nice and moist already, then you can start using the KY. You can just start using KY as a moisturizer. Just do it every day. After you bathe, moisturize your vagina. After you bathe, moisturize your vagina. Just do it every day. And that will settle. That is one way. Or maybe you are just menopausing. You don't need HRT. You don't need hormone at all. You just every day use the moisturizer will help already. So some people already many years menopause and they find sex is so painful, so dreadful, but no choice, their husband want, they still do, and is suffering every time she do. In these women, sometimes we may give hormone first for a while, just 1 month or 2 months, just to get your vagina moist back, and then you start applying KY every day. Applying KY every day, and you can top up with probiotic. KY plus probiotic regularly will have solved this problem already. So you insert probiotic every week or twice a week and put KY every day, that will solve your problem. Okay? If not, if it's very painful, then you need some hormone, either through tablet or even hormone cream. Hormone cream to apply vaginally just for 1 month, just to make it moist for a while, and then you can start using KY every day, or you can start putting the probiotic every day. Not every day. Probiotics we only put once or twice a week. Okay, then what is next? What is next? Next we can consider is a vaginal dilator. Vaginal dilator is something you can use for women who have menopause for quite some time, and probably too long already. Because when women don't have sex for too long, then what happens is your vagina actually shrink, you know. You know those old auntie who never have sex for like 10 years, 20 years, some of them, the vagina is now as small as a 12-year-old girl, 10-year-old girl. It actually shrink. So what happens is that sometimes, you know, we cannot say, oh, people miss no sex forever, no sex. Maybe with the previous husband, because of certain medical illness, they stop having sex for like 1 year, 2 years, 3 years, and then suddenly one day, maybe you recover from your illness already, or your husband also recover. Because I've seen cases like husband got cancer, so go for surgery lah, chemo lah, radio lah. So for a long time, they never have sex at all. But recover already. Your husband now well, healthy already. For 1 year no sex, then your vagina actually will shrink. Some of these women, of course, if I put you back on hormone, it will recover back. That is one option. But some women, they just don't want hormone. If you don't want hormone, then another way is to use vaginal dilator. That is to buy the dilator and insert in, and at the same time use KY, and also maybe use some hormone cream and slowly dilate back the vagina to the size that is considered the normal size of a vagina. Then you can start having sex back. So there are many things we can do lah. So we can mix and match all these things depending on the needs and the situation. So some of you may want to take hormones first. Some of you don't want. Some of you don't mind a dilator. Some of you think of dilator also scared. Some of you don't like to put moisturizer because you don't want to put your finger inside your vagina. So everyone is different. So some women, their finger they don't want to put in, but dilator they don't mind. So I say you put the moisturizer on your dilator and go in. Same thing. Okay, so there are many ways, and you mix and match depending on your needs and depending on what you're comfortable with. But basically, no sex after menopause is not an illness lah, or painful sex is not an illness. So it's not something that, you know, you need to declare to, you know, some of you I see everything tell insurance company. Then I get all kind of funny questionnaire from your insurance company. It's not an illness. You don't need to tell your insurance company. So, and there's no life threatening as well, except in one situation. In what way would painful sex cause an illness, a life-threatening illness? Can it cause life-threatening illness? Only in one situation, which I see occasionally. This thing is when the needs doesn't meet. Husband want more sex, but wife pain, so push away husband. So when this thing happen, that is when you will see some men actually resort to other women. Okay, so what happened is I do see occasionally women, you know, in their 60s, 70s having sexually transmitted disease, and that is the only thing we worry lah. Sexually transmitted disease, because most of you not going to wear condom already, right? When you have sex at the age of 60, because you're not thinking about pregnancy anymore, you're not worried, so you don't wear condom, and that is when sexually transmitted disease do come, because of all these unmatched needs between the husband and wife. So it's better for women, when you have painful sex and you know your husband still want to have sex, it's better that you get yourself treated. See your gynae, ask for options, do some of the simple things that I told you that you can do for yourself, like going and buy KY and start moisturizing your vagina every day. That's the easiest you can do, and don't need prescription one, and you can just do it. Other methods, you probably need to see gynae to get a prescription. Okay, so this is how you can take care of yourself after you menopause to maintain a healthy sex life. So if you have any question, please post up in my comment section, and if you have anything you want to ask even out of this topic, you can also put it in the comment section, and I will see when is the suitable time for me to talk about this topic in the future. Okay, and for those of you who have not subscribed YouTube channel, please subscribe to my YouTube channel and click on the notification button, yeah, so in case you miss our live video, at least all the new videos that are posted will be posted up there and you will be aware of it. Okay, so please go to my YouTube channel and subscribe and click on to the notification button. Okay? Any questions that you want to ask me, not related to menopause also, you can post it up in this comment section also. Okay? So let's see if you have any questions so far. Okay? I see a lot of highs. I don't notice any questions so far. Okay, hi Amy. Hi Vivian. Hi Fateh Nashra. Okay. Salwa Zin, hi. Oh, you miss coming to my clinic. Oh, don't miss coming. You can always welcome to come. If you have any problem, just come to my clinic, okay? Whether MCO or not, you're all welcome. You just need letter from the clinic to be able to cross district or even cross state, okay? Ho Ling Pei said, husband can misunderstand when apply KY every day to moisture the vagina because what they think KY is applied for during dry sex. Yeah, that's a misconception, no? So if your husband misunderstands, please ask your husband to listen to my video lah. Okay? So that is a misconception. So we know that, let them know so that they understand. Okay? So that's why a lot of women will know when they apply KY during sex, it doesn't actually solve their problem completely. Many of them still feel pain after that. So you need to apply daily, and at the same time you also can apply during sex. One of the reasons why we ask you to apply daily is the same reason as what I mentioned earlier. The more you have sex, the more it will be lubricated. So actually what I want you to do is to actually put your finger into your vagina every day. Because if your husband is not having sex with you every day, then you put your finger into your vagina every day. Or you put a vagina dilator into your vagina every day. So that is one of the way to stimulate your vagina to produce moisture. So that is one of the reasons lah. Okay? For non-menopausal lady who are trying to conceive, KY will affect the sperm mobility, right? Okay. One thing we do realize, if you use a lot of KY when you're trying to have sex, you do realize trying to get pregnant, one of the thing we do notice is the chances of the pregnancy rate is not very high. But in some women, they can still conceive, but not really all cannot conceive. Why? That's what you need to look at. One of my videos on fertility. One thing you need to understand about fertility. Fertility is not about having sex. It's never and never about having sex. It's never about having sex during fertile period. A lot of people think as long as I have sex during fertile period, I'll get pregnant. No such thing, you know. That is why a lot of people having sex during fertile period and still cannot get pregnant. In order to get pregnant, you also need quality sex. And when you have quality sex, you should not be having vaginal dryness. That's why we know that when we assess a couple with fertility, one of the things we want to assess is she having any problem, sexual problem? It doesn't matter whether the wife or the husband, any sexual problem. Because when you have sexual problem, including painful sex, it is a sign of fertility stress and it is a reason for not getting pregnant. Not necessary you need to use KY. It will make pregnancy more difficult. So this is very complicated. You want to know more about this, it's better you sign up to my fertility seminar. I have fertility seminar which I run twice a year. It will be posted in my Facebook when it comes. I don't think we'll be doing it in this, we just had it not long ago. My next fertility seminar most likely will be in April or May. I think it's May, it'll be May or June. So you can go and attend my fertility seminar, and then you'll understand more why this thing causes you cannot get pregnant. Not really due to the KY, but the fact that you use KY, that is why you cannot get pregnant. Okay, so Agnes asks, I had my hysterectomy 2 years ago and now I have very dry vagina and no more interest to have sex. Is it normal? Yes, it can affect, especially if your ovaries are removed. That's why, as far as I'm concerned, I don't remove women's ovary, even whatever age they are. Unless their problem is in the ovary, then no choice lor. Your problem is in your ovary, then you need to remove your ovary. If not, ovary is very important for women. For one of the reason is this. Because if you still have your ovary, then you will still have mood to have sex, and you will also still have so much issues about vaginal dryness. Vaginal dryness is even more significant when your ovaries are removed compared to women who menopause only but ovaries still there. So that is why we try to keep our ovaries whenever we remove the uterus. 20 years ago, the old school of thought, when I was young, 20 years back when I first became doctor, that is how we were taught. All my teachers would teach me, when you, anybody 40 years old and above, you take out the uterus, you take out the ovary lah, don't keep. Let them menopause at the age of 40 is fine. But nowadays we know it's not. Because we need to think about quality of life. And this is one of the things. Quality of life is not just a sex life, but a lot other things about quality of life that we know makes a difference whether you have ovary or no ovary. So the new thinking is keep the ovary unless the problem is in the ovary. But the old thinking is take out the ovary. So I tell you, even until today, the world of doctors, the world of gynaes cannot agree. I still remember last year, not last year, the year before the MCO 2019, I went to a conference in Bangkok. It was an international conference. So there was this speaker from Russia who came and presented all his works of how he removed the uterus, and most of the cases he left behind the ovary. And then there was this very senior doctor from India who came out and spoke. And he said, why you keep the ovary? All these women so old already, why you keep the ovary? And then you know why? In the conference they actually have like a debate. They're arguing with each other. So you see, even the world of doctors, and this is like very typical. In Russia, women's quality of life is very important. In the West, they place importance in women's quality of life after menopause. So as a result, they tend to keep the ovary. But in some Asian countries, like in India, probably in India, especially an old-timer, he's a very old-timer, he may feel that women have no rights and no quality of life anyway, because very often in India, the culture, especially in the past, women have no quality of life to talk about even when they're young, don't talk about when they're old. So probably he doesn't see any importance in women's quality of life. So in Malaysia also, I see the same thing. There's still a lot of gynaes that still have old thinking, like how my teachers used to teach me, that is remove all the ovary. But many of us have already shifted to newer thinking, which is more towards how the Western people think, that is we still need to think about women's quality of life, okay? Women got rights to quality of life, yeah? Because women today are also educated, are more active. You don't expect women in their 60s to be sitting at home, doing nothing but cooking 3 meals and taking care of grandchildren. A lot of women in 60s are still very active going on holidays, active helping out in NGOs, in welfare departments, welfare organizations, active working, active doing businesses. So we still need to think about women's quality of life even after menopause. So we need to keep their ovary if possible, unless their ovary is the problem. If the ovary is the one with problem, then sometimes no choice. But if ovary is still good, better keep the ovary. So this is one case example. If you remove your uterus together with your ovary, you will have this problem, but not a big problem. The same thing that I told you just now will solve your problem. So you can either go on hormone for a while to moisture back your vagina, and then after that you can use daily KY or use vaginal dilator and plus probiotic tablets every day. Do that every day. That will still solve your vaginal dryness problem. No worry, it can still be solved. No worries, okay? Yeah, but the interest in having sex will not solve so easily unless you are actually taking hormone tablet. So some women, because if you have some issues in the unequal needs, that means your husband still want to have sex and you find it very painful. Okay, I know some women will be okay if it's just As long as no more pain, I'm fine. He want to do it, just let him do it and finish with it. But some women still want to enjoy sex. Then one of the ways is to take hormone tablet, or not necessarily the hormone tablet that we take in menopause. There are other hormone tablets that you can take just for mood to have sex only. Also you can take, or start doing it more and find ways to enjoy. Sometimes mood for sex is also all in the mind. So you also need to cultivate sex. So sometimes I always say couples need to work on sex quality. So when you work on sex quality, sometimes it will come back. Okay? Ku Mingli asks, is there any supplement that women should consume to protect her ovaries? If it's supplement, I can't think of any. But if you want to protect your ovary, please go and look at my video on ways to prevent ovarian cancer. Ways to prevent ovarian cancer, I will mention there already. Because a lot of things that, almost everything that grow in the ovary, high chance of becoming cancer. So at the end of the day, we need to prevent ovarian cancer. Is the same thing. The same thing to prevent ovary from having any problem is the same as ways to prevent ovarian cancer. Okay, so go to my YouTube channel and watch on ovarian cancer prevention. Okay, I guess that's all the questions we have today. Thanks again. Once again, I want to thank all of you for staying up, tuning in for my Sunday 9 p.m. live video. So again, same thing, next week will be the same day, same time, yeah? And next week we will run a whole series on endometriosis. So for any of you who are interested in endometriosis, do stay tuned to my video next week. And for any of you who have missed my previous videos and wish to know more, please go to my YouTube channel and look up for the videos that you are interested. Okay? So that's all for today. Thank you, bye-bye. See you again, same day, same time next week, okay? Bye!